So we have a question here asking if there's a universally accepted definition for rapid reviews, and I would say that the answer to that is no. There's also a question, when would it be inappropriate to do a rapid review instead of systematic review? So that's a fantastic question. So for that question, I think it really depends on the knowledge user and their comfort level. You have to be very clear about, you know, the methodological tailoring that you're going to be doing in that rapid review. So there might be times where you feel that a rapid review is not appropriate versus a systematic review, and that's something that there are no set rules on that. You really have to think about the methods, you have to think about the knowledge user needs, and you have to think of the impact, how many people are being impacted by this decision, and what you have to be very thoughtful about your approach for the rapid review and make sure that you're going to hopefully come up with a somewhat accurate answer for that rapid review. So we also heard, I had a quick question about the difference between a retrospective and prospective assessment. So as you saw, the retrospective assessment for rapid reviews and systematic reviews on the same topic, that was published in the Journal of Clinical Epidemiology. That's where I used the sample from the past, where they weren't intending to match this rapid review and the systematic review. Whereas for the prospective study that I'm doing, which is called SPARKS, for that prospective study, it is in real time, a systematic review is coming in, and then another center is being randomly selected to do the rapid review on the same topic. So that's the difference between a retrospective and a prospective study. So I have a fantastic question here from my colleague Declan Devane, and asking how did we find funding for our SPARKS, the quasi-experimental prospective study. So we were very fortunate to get this from the Canadian Institutes of Health Research, which is about a 10 to 14% chance of success. So very tricky to get funding there. And it is hard to get funding for methodological work, absolutely. But was quite lucky to get that funding. I also have a question here. What is the relation between rapid reviews and living systematic reviews? So I think that with the living systematic reviews, you're continuously updating them. So you do the full-blown systematic review, and then you continuously update them. And you can use perhaps some automation techniques as well as crowdsourcing techniques to get that living systematic review, just to make it a bit more feasible with those continuous updates. So there are a little bit of differences between a rapid review and a living systematic review. So, you know, with a rapid review, it's a one-time thing. We're giving it to the decision maker, and then hopefully that they can base their decision on that. So that would be one big difference. I'm gonna take a couple more questions now, and then we'll continue on in the end. So can a rapid review be part of the systematic review? So it's a fantastic question from Joseph Yang. So absolutely, and in our center, oftentimes we do the rapid review to submit the report to our knowledge users. So let's say, you know, it's Health Canada. So I do a lot of work with Health Canada. So let's say Health Canada has a decision to make in 3 months, I give them the report, and then now I want to publish my rapid review, I convert it to a systematic review, which takes me a year, and then publish it. So absolutely, you can do the rapid review to get the results to your knowledge user, then do the full systematic review, and then I always send that final systematic review back to my knowledge user so they're aware of the final results. Is it feasible to assess the uncertainty of evidence from a rapid review using the grade approach? So absolutely, I think you can use grade for anything. I haven't seen grade being produced for rapid reviews, but perhaps that's an area for future research. So absolutely, I think you can use grade on anything. And another fantastic comment here from my colleague Declan, saying perhaps we undersell rapid reviews by not including systematic in the nomenclature, and they are still systematic. So completely agree. When we did our scoping review of rapid reviews, there's so many different terms out there for rapid reviews. But I agree, we're always trying to stay true to that systematic review and to that process. And we're just trying to methodologically tailor our approach according to what our knowledge user needs. So it's a very relevant and practical way to do knowledge synthesis. And I'll do one last one, which is from Therese Dalsbo, asking, there's only one rapid review published in Cochrane. Is there a program to advance these rapid reviews to full systematic reviews? So I'm not sure if the one rapid review in Cochrane will be a full systematic review. Unfortunately, I don't know that information. I'm assuming the rapid review conveners would know the answer to that question. But it's definitely very interesting, and very interesting to see as more rapid reviews become available in the Cochrane Library. So this is a question from Michelle Hilton Boone. So the key question seems to be how conclusions differ between rapid reviews and systematic reviews, and what characteristics are associated with inaccurate, misleading conclusions in rapid reviews. So that's exactly it. So, and then what was the small pair sample? So when we looked at the conclusions between rapid reviews and systematic reviews in that small study, we saw that they were pretty much consistent. However, there was one case where the rapid review had missed an adverse harm for a subgroup, so a really important subgroup population, and so the conclusions differed a bit with that pair. So, I mean, high level, like this is 40,000 foot level response to your question, Michelle, would be that on average, they seem to be consistent based on the retrospective study. However, sometimes we can miss the mark. So it is something we have to proceed with caution, and in particular, what we found was with that subgroup. Again, our prospective quasi-experimental study will hopefully provide us with more information. So this is Gabriel from Sydney, who said the PRISMA study is interesting, and so the work has been on intended and actual use of rapid reviews. So completely agree, Gabriel, that's so, so important. And exactly that, you know, when would we use a rapid review? And, you know, thinking through, there was a Delphi that I was actually a part of where we're trying to figure out and tease that out a bit more, you know, like when, kind of like a decision tool, support tool of when would you use a rapid review versus a systematic review type of thing. So that is also another area for future research. I think that would be really interesting. We have a question here from Pascal Bro. So I work in a family medicine teaching unit in Quebec. One of the challenges we face is to teach residents to stay up to date and find the answer to clinical questions. To me, rapid reviews are a clear answer. And a very interesting way to improve this field would be to look forward on how this can be linked with medical education. So absolutely, Pascal, that's a great comment, and great, you know, thinking through how can we link how to do a rapid review and teaching, you know, medical residents on how to do rapid reviews. So absolutely, and I'd be happy if you wanted to reach out to me, and happy to discuss, you know, how we could potentially push that forward. A question here from Manisha Gupta. Do rapid reviews go through the editorial feedback process prior to publication? So absolutely, and when we look at the rapid reviews, most of them do go through some kind of a peer review kind of process prior to the report. If it's a publication in a journal, all of those, you know, if it's a journal where they send it out for peer review, which is hopefully the journals that we're submitting our papers to, then yes, they would go through the same rigorous peer review process. And I agree that one of the time-consuming process is the editorial feedback process. So the thing is, if it's a rapid review, even if it's going through the editorial feedback process for the report and not the publication, then those timelines would probably be a lot stricter. So instead of giving a month for the editorial feedback process, you know, they'd give a week, for example. A question here, Martin Alberto Ragusa. So which two databases would you choose for a rapid review? So I think it really depends on your rapid review question, right? So if it's within medicine, then perhaps you would use Medline and Embase, for example, are probably the two most common ones. But what if it's an allied health question? Then maybe you would use CINAHL and Medline, for example. So it really depends, Martin, on what the topic is for your rapid review. And then would you use clinical trials if you're looking at a new drug? Absolutely. You know, if you need information that on drugs that are just brand new, you probably won't find much in the published literature, then perhaps you have to go to clinical trials or maybe even going to conference abstracts to grab the data on those new drugs. So absolutely, you have to be very mindful of your topic when you're thinking through your literature sources. A question here from Ann Madden. How would you give a plain language definition of how you have conducted your review, and what if there are any limits you would put on your findings? So that's a great question. Yeah, so it would just be maybe coming up with 5 bullets of what are the streamlined methods or the tailored approaches in your methods. It would be like thinking about your discussion section where you would talk about the limitations. You know, so it has to be limited. This has to be interpreted with caution. We only looked at the last 10 years. We only looked at published literature. You know, all of our studies came from high-income economy countries. So it's just being mindful of your streamlined approaches and how you may have missed certain things in your rapid review, and being very transparent about that. I have a question here from Janeda Salas. What difference between rapid review for evidence-informed policy? So I'm sorry, Janina, I'm not exactly sure what this question means. So what is the difference between rapid reviews for evidence-informed policy? So you mean the difference between rapid reviews and systematic reviews? If that's what your question is, then the difference would be that just the rapid review, you tailor your methods and you're trying to get it to them in a faster way, a more quicker, expedited approach to evidence-informed policymaking. Okay, Martin, asking the same question again. I have a question here from Ariana Maver-Amit. What is the difference between a systematized review and rapid review? So, like my colleague Declan mentioned, a rapid review is still using systematic methods, okay? So I don't want to feel like we're just going to throw out, you know, the Cochrane Handbook and do whatever the heck we want. No, we're going to follow the Cochrane Handbook as closely as possible, but we're going to tailor our methods according to what our knowledge user needs. So that's why Declan was saying maybe we should call it a systematic rapid review, right? But hopefully we can make it very clear that we are following the Cochrane Handbook, but we are going to tailor our methods to what our knowledge user needs. Okay, a question from Evelina Roginsinska, and I apologize if I'm saying everyone's name wrong. So, aren't you concerned that the results of a rapid review may lead to misleading conclusions in comparison to full-scale systematic reviews? If not, why should we bother with full-scale systematic review? Fantastic question, and that's the whole point of our doing the SPARK study. So for me, at the end of the day, I want to be able to go into Health Canada and say, yes, I can give you my results within 3 months, but there's a 25% chance that the answer I give you is going to be wrong or inaccurate, right? So I completely agree. So that's why we're doing this prospective study, which is taking a lot of money and a lot of time and a lot of effort and energy for us to figure out, do the conclusions, are they similar enough? Are they in the ballpark? How inaccurate are they? And if they're accurate enough, then yes, maybe we should be doing more rapid reviews. Therese has a great list of tools of review work. I'm assuming this is for rapid reviews, so perhaps, Dario, we can grab this from the questions, and we can send this actually to the attendees if that would be okay. So Stephanie was asking where can she get, Stephanie Prince, hi Stephanie, shout out to Stephanie, asking where we can get a copy of the slides. So I'm hoping, Anna, maybe we can give you the last minute or two to let that know, but they will be posted and I'm happy to share widely. Therese is giving some more tools, so again, if we can send those out. And then, is anyone working on rapid reviews of trial methodology studies? So then, and then also wondering, this is from Miranda Cumston, fantastic question. So wondering if it's for when we're thinking about complex health system questions, if rapid reviews are appropriate. So absolutely, Miranda, these are two great areas where perhaps more research is required.